Hi, my name is Sam Kippen, and my student number is T00698764. I just wanted to talk a little bit about my experience with cooperative veterinary care. The clinic that I work at, we've got a pretty good team. I think that it's really important for cooperative veterinary care to work that everyone knows their position that they're supposed to be in, and they're working at the best of their level in their position. So that means receptionists are working the best they can to be the best receptionists they can be. Doctors are working to be the best veterinarians that they can be. Technicians are working to become the best technicians they can be. Continued education is so important for that, for every single position. We can always be learning. We can always be learning to be better individuals, and we can always learn how to be better with working with our team members. So it's really important that we learn to work well together, but that we also learn how to fulfill our positions to the best of our abilities. I think that it's not only important that we're able to work well together as a team, but that we're also able to work well with our clients and with our patients. So I don't think that cooperative veterinary care stops at the level of just within the clinic. I think that it also relates to when we're working with our patients and when we're working with our clients. So I think that what that means is that we're able to take really good histories from our clients, really understand from their perspective what they view as a problem or a complaint about their animal, whether that is a behavioral issue or whether that is a physical issue that they're perceiving. Either way, it could be considered a medical issue, but we understand why they're here. Why is this client coming in today? Why are they bringing this patient into us? So it's really important that everyone on the team is able to communicate well together and communicate well with our clients. So we want to be able to be, each individual person on the team, good at taking histories. So I think that's really important across the board. And then it goes even farther when we're looking into the patients. So I think it was so important that we had to do fear-free for this semester. I think it's so important because, and it went really well with when we were learning animal nursing skills, because for technicians, we all are going to be having to take blood draws, we all have to do injections, we're going to have to be working hands-on with the patients for a number of different procedures, and I think it is so important that we learn how to take care of patients' mental well-beings and physical well-beings as well. And that we consider both of those things when we're looking at the health of an animal. So even though we might need to give a patient a vaccine or we might need to do a blood draw, I think it truly is important, just like we learned during fear-free, to assess what really is a need here today and what is a want. What will this animal allow and tolerate and feel comfortable with us doing today? And is that a need or a want? If it really is just a want and that animal seems really fearful, it is best to wait, or maybe it's best to sedate or discuss those options with your doctor. But to not push animals to where they're uncomfortable. I think that's so important that we learned that when we were doing our animal nursing course, because it really is important that we look at the behavioral and mental side of an animal and not just the physical. I think mental health is developing so much in human medicine, and it's important that it is in animal medicine as well. And we're looking at animals as sentient beings. It's so important, because if we want to have animals having positive experiences in the future in the clinic, and we want them returning, then it's so important that they end up coming in and we're not pushing them, not making them feel uncomfortable. We're looking at things to enhance their experience while they're in our clinic. So what that can mean is for a cat, for instance, that we're looking at that cat if we need to do a blood draw, and we're saying, okay, well, how can we make this more comfortable for this patient? And it's looking at each patient as an individual and seeing what works best and makes that patient most comfortable. Some cats might respond very well to hands-off and that can be considered fear-free or very little restraint. Other cats might feel more comfortable in a towel wrap or hidden partly under a box. It really depends on that individual. It's also important that when we're looking at dogs, if we have a nervous dog, that we let them come to us. We make it feel like they're more on their terms, they're more comfortable. So I think the cooperative veterinary care, it really goes in 3 different directions. It's working with the team that we have, it's working with the patients that we have, and it's working with the clients we have, and trying to work with all 3 of those aspects in a cooperative way, because that's how we're going to be the most successful as technicians, and that's how we're going to be able to provide the best patient care, is really by being cooperative in all aspects of our jobs. And what that's going to mean is that we're open to learning, and we're open to input, and that we're open to the fact that we might not always have the best answer, but we hopefully have a colleague or a coworker that has an input in a situation and experiences in a situation where maybe we can learn from each other. But the most important thing in cooperation is that we're able to listen to each other, listen and learn from each other. And if we're not doing that every day, if we're not going into work with the hope of learning something and taking something away, and we're not actually learning something new every day, then I think we're failing as individuals. And I think it's important that even beyond this program, that we're constantly going into work with the idea that we're going to shape ourselves as technicians and as people, and that we're going to take something away as a learning lesson from each individual day. Because that's the great thing about medicine, is we can always learn more. We can always learn how to work better as a team. We can always learn how to take a better history or work with our clients better, and we can always learn how to provide better patient care. Sometimes it's really hard in the moment when you're working with someone in a heated situation, or it can be very hard when you're working with a patient that is stressed out, and might feel like there's a pressure and a time restraint for getting a procedure done, or it might feel really stressful working with a difficult client. But the best thing we can do is realize that, you know what, we're all in this together. The reason we're all at the clinic, and the reason we all should be at our clinics, is that we want to be able to have the ultimate goal of helping animals. We want to help every animal that walks through that door. That's going to mean something very different for each individual patient, but our job as technicians is to help every animal that walks through that door to the best of our abilities. So we want to be able to step back from each situation, even when they are very stressful, take a minute and try and take ourselves out of the situation and kind of look at the situation from above and outside of the situation. So that way we can truly have an idea of what is going on in this moment. How can we best respond? What should we be doing? Because if we don't, then it ends up often that we're very heated and very in the moment. And no one really thinks best when they're in that kind of situation. So just to take a step back, analyze what's going on, and then react. I think that's so important, and it will help us to be able to work better with our patients, with our coworkers, and with our clients. All right. Thank you, and I really enjoyed this semester.